We'll be recording. So greetings and thank you for joining us this morning to learn more about advocating for school health. I'm Michelle Smith. I am the state coordinator for Action for Healthy Kids here in Texas. Just a quick little bit about our organization. Action for Healthy Kids has been engaged in work with schools around nutrition and physical activity since 2002, when Dr. David Satcher was the Surgeon General and he declared we had an obesity epidemic. Teams from across the US gathered in Washington to strategize how we could have an impact through schools on our children's health. And our Texas team has worked for the last 20 years around everything to do with nutrition policy, physical education, physical activity, recess, and social emotional health of children. Just a couple of quick logistics. I don't have Q&A because we are in a meeting format as opposed to a webinar. So you can introduce yourself in chat, put in your name, your organization if you'd like, so we all know kind of who's here. And then any questions you have, go ahead and drop them into chat. And we will have an opportunity for Q&A at the end of each session. So if you leave, you can use the same link to sign back in. So that's not a problem. We just have to readmit you. So sometimes it may take just a second. We are recording this session and we will send a link of the recording along with a PDF of the slides and any resources that our presenters happen to mention in a follow-up email within the next week. Today, we are talking about advocating for healthy schools. We're coming out on the other side of a pandemic and all the issues that relate to that, but we have to make sure that we're addressing all the health issues that impact our children and doing everything we can to keep them healthy and ready to learn. We talk about it taking a community to raise a child, and one of the important roles the community has and can be involved in is advocating for healthy programs and practices in schools. This workshop is part of our work with the El Paso, but it also has statewide implications. So we have invited outside El Paso to join us today. And it's funded by the Paso del Norte Health Foundation. We've been working for the last 4 years with school districts and the community to improve physical activity opportunities in schools, ensure our children have healthy school meals, and most recently, focusing on youth tobacco prevention. And one of our key strategies has been to engage more parents in all of these efforts. So for our agenda today, we have a really good lineup on different aspects of advocacy. First, Raquel and I will share about advocating at the district level through school health advisory councils. Then we're going to hear from Alec and Eva about key points you need to advocate for youth tobacco prevention. During our session this afternoon, Karen Burnell will share important role of parents and PTA can play in advocacy, and Corey and Michelle will share how to effectively advocate for safe route to school programs. So please ask questions, share your thoughts and concerns. We want you to leave today confident to discuss these topics and others with school administrators, school board members, even legislators. Our children's health is their greatest asset, and everything they do depends on them being healthy to be successful. So we need all of you out there to help ensure that success. I want to talk just a bit about the law and policy and the role that they play in health. It's over time, the law has played an integral part in many of the public health victories we've had. All the items you see here were results of legal efforts and legislation. Public health has had to rely on policy to ensure people are safe from toxins, that they travel safely, and that they have a healthy environment to live in. I'm sure most of you grew up with the seatbelt law. I know my grandmother, I don't think she wanted to wear it in her whole 104 years, but all of us, it's become like second nature. And even though it was challenging in the beginning, we use it and it saves so many lives over time. The same goes for a lot of the legislation and policies that have been put in place over the years that relate to public health. I have to apologize for my allergies. They are challenging this year. With policies in place, we can ensure that change is sustainable. And in some ways, it makes it easier for people to make that healthy choice. Without policies, people tend to relapse or take an easy way out. And with children spending such a large part of their lives in school, we have worked over the years to help districts and schools be healthier learning environments. I think we discovered some of the issues when children started going remotely, and all of the issues we faced with children that had more sedentary lifestyles, weren't making as good of nutrition choices. And now that they're back in school, they have more opportunity to be active. They have potential to have healthier meals. So having these health policies in schools is essential. So a lot of the work we've done at the district level has been involved with school health advisory councils. I'm going to share a little bit of an overview about SHAC's role, and then Raquel is going to talk about how her SHAC has taken it a step further and even engages in state level policy work. Let's talk just a minute about the difference between advocacy and lobbying. A lot of people feel intimidated when you say the word advocacy, and they're concerned that it's something that they can't do. But advocacy in its simplest terms is just letting a government official, school board member, legislator, even a school administrator know what you think about a current or pending policy or legislation. While lobbying is advocacy, not all advocacy is lobbying. So advocacy is any action that speaks in favor of, or recommends, or argues for a cause. If it supports or defends, or you're pleading for behalf of others. It can include public education, regulatory work, litigation, and work before administrative bodies as well. Nonpartisan voter registration, nonpartisan voter education. Advocacy can be equated sometimes with education, educating people about an issue or a problem. In short, advocating for your mission encompasses just about any form of communication that an individual or a nonprofit can do. Now, when it comes to lobbying, that's communicating with decision makers, which would be elected officials and staff, voters on ballot measures, about existing or potential legislation, something specific, urging a vote on a for or against a bill. All three components of this definition are required. It has to have a decision maker, actual bill or legislation, and asking for a vote one way or another, as opposed to just sharing concerns over an issue and letting people know that you really believe children need more recess and would like to see something done about that. So if you have questions about lobbying and advocacy, just throw them into chat and we will be trying to answer some of those as we go forward. A little bit about what SHACs are. Hopefully most of you know what a SHAC is. And it is one of the best ways to advocate for healthy schools. The School Health Advisory Council, or the SHAC, works on health issues, and it can help a lot more than if you as an individual try to go in and make change around something like safe routes or vaping. It's a lot more challenging. So having a group like the School Health Advisory Council can help you be more effective. And SHACs are mandatory by state law. Each school district in the state should have a school health advisory council. If yours doesn't, then talk to us and we'll see what we can do to help make that happen. They should be appointed by the school board, and they should also be 50% or more parents, so that parents have a voice around health decisions at the district level. They are the voice for parents and the community, and they're an excellent way to educate the district and the school board on how important health is to academic success. SHACs discuss anything to do with child health, and every district or every community has different issues. So the SHAC can focus on the issues that are most important in your community. They are mandated to review all health-related curriculum, and they can provide information on any health topic. Over the last year, 10 years, almost 20 years, I guess now, SHAC's responsibilities and scope have been modified through the legislature to include all 8 components of coordinated school health, which is basically the same as the whole child model and the components that are incorporated there. When it comes to working with your school district, joining your district SHAC is always my first suggestion. As I mentioned, they're mandated and they should have a majority of parents, and they can address any health issue that impacts children. And the district is mandated to publish when and where and how often SHACs are meeting. So check with your district website, and you should be able to search for SHAC and find information about your SHAC, or you can contact your administrative offices and ask when and how do I get involved with my SHAC. There are other state mandates that SHACs try to help with around physical activity, around teaching coordinated school health. Wellness policies is something that SHACs work on. All of those are important parts of keeping kids healthy. These questions that I put here are things that you can ask to get you started advocating for school health issues at the district level. If you're not sure about reaching out to the district, talk to your school principal or maybe a PE teacher or school nurse. Even some of your nonprofits or groups like AgriLife are engaged with school health advisory councils, and they might be a good place for you to start talking to people about anything you're concerned about and get them involved and get in the door with a SHAC. I would also, because of COVID and some of the SHACs have not been as active as they were before the pandemic, but it really is a critical time for SHACs to stay engaged. We've had districts who wanted to reduce physical education and physical activity to make sure that there was time for academics and concerned about loss of learning. Our nutrition departments are being challenged with supply chain issues and staff shortages and lower meal participation. Students have been home, as I mentioned, and developed some unhealthy eating habits and lack of physical activity, not to mention the mental health concerns that our kids are facing after the pandemic. So all of this means that SHACs are important, and they need to be focused on helping districts move forward in a way that respects child health and the role it plays with student success, and don't forget and throw things aside just for academics. SHACs bring people together for school health. We must learn from what we have experienced during this time of crisis to be better prepared for the future. We have a chance to reevaluate our priorities and bring focus to the things that matter most, our families and our health. Without health, nothing else really matters. So if you are a school staff or community member or a parent, identify the issues that are impacting your schools and your district. Reach out and meet with someone from your SHAC or go to a SHAC meeting and start developing plans that address issues in the short term, but also are planning for future health issues. There's a quote from Margaret Mead I feel is very applicable to SHACs. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So we've talked about SHACs and their work at the district level, but it's always helpful if you have a policy in place that encourages districts to bring focus to child health. I know a lot of times districts might not have considered mandating recess, but there is a law that says all SHACs will review and make recommendations around recess. And once people get involved and interested in a topic and look at things and find out, for instance, that kids don't have recess, then they come out and discuss it. And there's a lot of information out there that can be shared around the importance of recess and why kids need that physical activity. And then once administrators are more aware and school boards are more aware, then you can get a recess policy passed. The same thing can happen around vaping or one of the other issues that we'll talk about today. Our legislators do have full plates, however, so we need to make sure that they understand all the issues and the impact that they're having on student success. Besides working on policy at the district level, I want to encourage you to identify your legislators and reach out to them, ask to meet with them or ask to meet with one of their staff people that works on issues like school health policy, and then share with them about school health advisory councils. A lot of times the legislators get misinformation on something like a school health advisory council, and then they don't want to be supportive of them. We want them to know the important work that SHACs do, and that they're not just another burden or an unfunded mandate for districts. We'd also like to encourage you to join our newly forming school health network or SHAC network. We have about 200 members right now, but our goal is to have members in every district across the state. This network, we want to keep them informed on any upcoming legislation so that they can weigh in pro or con. We're not taking sides on some issues, but it's up to y'all to join us to keep informed on things that will impact your school health advisory councils and impact your children's health going into the next session. We are sending a PDF of these slides, so you will get this link, and we encourage you to join the School Health Network. It's you'll only get information relating to SHACs. It's not going to put you in anything that's going to get you a lot of additional emails from different places. These are some resources we've developed and we're going to make available through our new microsite, which hopefully will be launching in the next 2 weeks. There is one that is encouraging parents to join SHACs. There's one that explains to members what they need to be looking at as a SHAC member. And there's one that if you do decide you want to meet with your legislator or even a school board member, it talks about what SHACs do and why they're important, and gives a couple of organizations that support school health advisory councils. And this is just a snapshot of the SHAC microsite that we're putting in place. You will find all resources that relate to SHAC here, everything from evaluation tools like the School Health Index or the WellSat, information on wellness policies, all of the laws that pertain to SHAC, school health surveys, which are a campus level evaluation tool, and then different website resources on the whole child and different information that hopefully can help guide your SHACs moving forward. So now I think what I'd like to do is turn this over to Raquel. She's the SHAC member from Fort Bend ISD, and she's put together an advocacy subcommittee on her SHAC, which is the only one I'm aware of, which I think is really exciting. I'll let her share more about herself and her work. And as I mentioned, be sure and put your questions into chat. And if there's anything there that we need to answer, we will get to those after Raquel. So take it away, Raquel.
Great. Well, thank you, Michelle, and good morning, everybody. Soon to be.
Oops.
Uh-oh. Did you all hear me? It seemed
no,
like
you muted there for a minute.
Okay. All right. Well, okay, so I'll just start again. Good morning, everyone. Raquel Roberts. I'm a parent member of the Fort Bend Independent School District SHAC, and I've had the pleasure of serving as our advocacy lead, and I'll share with you a little bit about what we've been up to. I am a mom of a 12-year-old son wwho attends Sugarland Middle School within the district. He transitioned from 5th grade to 6th grade this year. And as you know, during COVID, there's been a lot of transition. And so, if you're a parent, you probably can guess how life has been like for us. But, I have always had a vested interest, of course, in his well-being, but moreover, have had an interest in the well-being of students within our district. And so just to give you a little bit of background, I joined our SHAC in 2020. And in 2021, the opportunity came about to do a little bit more in the advocacy space. This was a vision of our chair for the district SHAC, and even the chair before her, Melanie, I believe she's on visiting with us today. And, to carry out that vision, there needs to be structure, right? So we felt like launching a legislative advocacy committee would be the right thing to do. We've actually since sort of reconfigured how we think about ourselves a bit. So no longer, we've kind of dropped the legislative piece to how we refer to ourselves, largely because we see a role for advocacy not just in the state legislature, but in other avenues as well. And also to acknowledge the work that's already being done at the district level when it comes to SHAC's role in advocacy and working in partnership with school board trustees. So that's a little bit of background. So now let's get into why we exist as a committee. So here on this slide, it really just spells out why we're here, why we got organized. We felt that there was a need to build some capacity within parents, staff, and students, where all of us can feel more comfortable advocating for school wellness, and not just at the local level within school districts, but also more broadly at the state level. And so our North Star, there's a couple of them. We look at the whole school, whole community, whole child model. And there's also the profile of a graduate that was developed by the school district. The next slide will show you graphically what that looks like. So to the left is that WISC model I was just referring to. Like many SHACs, there are subcommittees that are organized around those key functions of that model. So you'll see efforts that are directed towards health education, physical education, social and emotional learning, mental health and wellness, those kinds of things. And then to the right, Michelle, can you go back? So I just want to make sure folks have an opportunity to see what's contained in the profile of a graduate. Thank you. Oh, you're good right there. Thank you. And so this is what it means. This is what we're referring to when we say that we have a profile of a graduate. I mean, it's really about building strong character. It's about equipping students for success beyond academics. And that's something that the WISC model and together with the profile of a graduate is really about, right? You know, looking and acknowledging, of course, the importance of academics, but knowing that there are other things in place that will lead to success for, you know, for a child upon graduation. Can you advance, Michelle? Thank you. So these are the core areas of our work. To the left, it's all about policy development. So this is really about the policy process, and I'll get into more details of what that means. But you can't do policy development with successful engagement. So and ongoing engagement. And by that, we are talking about engagement at multiple levels. So engaging with elected leaders, also engaging with organizations that are like-minded, and obviously can't do this without thinking about the students themselves, right? And so are there ways that we can engage students into our work in ways that really equip them for being advocates for their own well-being? And the best way to do that is really through deeper engagement with district administrators. And so I'll talk about some efforts and some things that we're thinking about in the future on that end. Next slide. Okay, so let's get into the policy development piece. You know, Michelle did speak on some of the differences between advocacy and lobbying. And as a committee, this is something that we had to have some discussion about ourselves to better understand what does this mean, you know, at a district level. You know, what can our SHAC do? What are some lines in the sand, if you will, that we should not exceed? And we were very supported by our legal counsel in coming up with guidelines that really spells that out. And so it's written up. We have something that we can refer to on a regular basis to shape and inform the work that we do. And in a nutshell, you know, we as parents or any member of SHAC can lobby on behalf of ourselves, not on behalf of SHAC. However, it's not a problem at all to say that, I am a member of SHAC, or in this case, I am a member of the Texas SHAC network when speaking on an issue. So we found ourselves grounded in those guidelines. We also felt that there was a need to begin just some ongoing education of what the policymaking process looks like in Texas. So we benefited from a presentation that was done by TASB, where there was basically some effort put into making some distinctions between the kind of decisions that lawmakers have responsibility for, so our legislators, and contrasting that with decisions that get made, say, with state agencies like the State Board of Education, or even the governor's office. So that's really important, because when you're thinking about who to advocate to, or what you want to advocate for, it's really important to know who to advocate to, who's really responsible for some of the decisions that you're trying to influence. So fast forward to some more recent effort in 2021, where, once the legislative session, the 87th legislative session ended, there were a lot of bills that passed that have direct impact on student wellness, some of which are very specific to SHAC, but then there are a lot that aren't very specific to SHAC. And so as a committee, we engaged with the district to get a better understanding, okay, what is the district's response to these different bills that passed? And there was greater opportunity to engage in that policy implementation process, more so where there was a SHAC mandate. And there then became this, this question surfaced about, well, what happens when there's bills that are going to get passed or have passed where there isn't a SHAC mandate? Is there a process for SHAC and others to weigh in on how policy should be implemented in those cases? And so there are some ongoing efforts to identify those processes and hopefully strengthen them so that SHAC can have greater ability to be a part of those decisions. This is particularly relevant in the case where we know there's been a lot of federal funding in response to COVID, where these decisions are made by our board trustees. But again, there is really no SHAC mandate when it comes to how funding decisions are made across a district. And so that invites yet another opportunity for SHAC engagement. So I mentioned before that there are these advocacy guidelines. So this last point is really about codifying our processes. We don't want our guidelines to just be in I guess on my Google Drive, right? We do want those to become more institutionalized. So there are some standard operating procedures, and we're working on ways that we can integrate those guidelines into those procedures so that those efforts can be sustained. Next slide. Okay, so now we're moving from just more the policy work to the engagement, which, they go hand in hand, right? And so we felt like it was important to do some engagement of our of representatives in the State House, but even beyond that, so that there could be greater awareness of the role of SHAC, but that also we could better understand some of their priorities. So during the legislative session, we invited a couple of state representatives to our meeting. So there was a newly elected member, State Rep J.C. Jaton, who came to our first meeting of the year. And then later, Representative Ron Reynolds also joined us. They represent different parts of Fort Bend County. And then, fast forward into just a few months ago, on the tail end of 2021, we invited Will Hickman, who represents more the Spring Branch area of Houston, but nevertheless serves on the State Board of Education and gave us some insight into decisions that were being made about sexual health curriculum and materials that were being updated at that level. So that was very insightful, just to get a better understanding of kind of what the State Board of Education's role is in that process relative to what could happen more at the district and local level. And then, of course, we do regularly engage with our very own trustees. And so when the advocacy committee got started, a former board trustee was very key in being a part of its creation, its development. She has since retired, but continues to serve and support the committee. We also have a current board trustee who is also participating in our efforts. So again, that ongoing engagement at multiple levels is really important. Finally, I'll just say, during last session, there were some efforts at the state level where there was some concern about to what degree SHACs could continue to operate in the freedom that it has in doing what it does. And so a few of us, called members who were looking at legislation, SB 347, HB 1525 here, and just weighing in our concerns. And this is a case where we were actually lobbying because as parents, some of us felt like these were not necessarily great for things that we wanted to do at the SHAC level. Okay, so moving on to engagement with other advocacy groups. This is very key to our work. We cannot do any of this alone in isolation to have the kind of impact that we really want to have, especially across the state. And so these are just a couple of ways that we've engaged other organizations. So Cornerstone Government Affairs is a lobbying group that I personally had done some work with in a previous role where I worked for the health department in Harris County as a policy and planning director. And the lobbyist there was very key in some initiatives around childhood obesity, continued to demonstrate a lot of passion for some of the issues. And so as far as getting a glimpse into kind of what happened once the session was over, he provided us that kind of an update which it's something that is needed as things change. We want to know how those changes would impact us locally. More recently, we engaged the Network of Behavioral Health Providers, which is a nonprofit that's based in Houston, Texas. They do advocacy among many other things. Their focus is mainly on mental and behavioral health more broadly, but they're also very vested in mental and behavioral health among students. And so they themselves were tracking student mental health related bills, provided us an update, but also gave us a glimpse into what we can anticipate in the future. So for instance, there is some concern about what could be perhaps an attack on any progress that was made in the area of social and emotional learning. So those are the kinds of things that we want to be mindful of and be watchful for in the coming session next year. Okay, so finally here, I just want to end with our engagement of students and just district staff in a little bit more detail. So there are student wellness coalitions in place at every high school within the district. This is really an opportunity for students to have agency and develop their agency when it comes to matters that are most important to them. So the things that they really want to advocate for. And there's no sense in us doing what we're trying to do within SHAC in isolation of what the student wellness coalitions are about. We definitely see that there could be some real synergy between what we do and what they do. So, just connecting with, in this case, I believe it's our social and emotional learning department that is responsible for managing these coalitions, wanting to engage with district leaders and students to help advance our respective goals. And then we're also looking at voter registration. I'm not sure if to what extent you all are aware of some of the gaps when it comes to a law and I guess implementation of the law around high school principals providing on an annual basis at minimum an opportunity for high school students to get registered to vote and making it easier for them to vote. There had been some recent acknowledgement in news that there are some gaps there. And so I think as a state, we can all do a better job of working with the district to ensure that students have that opportunity. I mean, it's for us, it's in direct alignment with our profile of a graduate, but then it also can tie back to that WISP model as well when it comes to social and emotional learning, right? And so these are examples where folks like you can go to that next level when it comes to engaging districts, district staff and students in your advocacy. So to wrap things up here, these are just a few things that I'd like you to take into consideration as far as next steps. So if you haven't already thought about this, or if you're at the early stages of your advocacy efforts, really think about ways that you can establish, really lay that foundation for sustainability. So if there's additional educational opportunities you can extend to others within your SHAC, district leaders, et cetera. I'm certain that Michelle would be a great resource in helping out with that. Those guidelines that I spoke of, having something written in paper that provides a good reference for how to do advocacy, so there won't be concerns there. Those are all very foundational pieces that will help you along the way. The other thing is really about organizing, right? So there needs to be a formal structure, and I say formal, but not really. I mean, a subcommittee is formal in the sense that we have members, but it's not rigid, is what I'm getting at. But having a venue for convening is really the point there, that you can do that within your district, but you can also become a member of the SHAC network that Michelle has invited us all to become a part of. Preparations for next session, it's never too early. So just getting to know your state legislators, getting to know other elected leaders, engaging with them one-on-one about issues that matter most to you. And then, of course, connections that you may have with other advocacy organizations that can point you to some possible areas for concern that you can get ahead of even now. Lastly, supporting district departments. We know that COVID has introduced a lot of challenges, right? Districts are pressured, and while we're on the tail end of the pandemic, there's still a lot to be done in terms of learning loss and in addressing mental and emotional health. SHAC is a wonderful way of volunteering, and so if there's opportunities to connect with specific departments to help sort of ease some of the burden, this is a good time to do that. So that's all I have for now, and I welcome any questions.
Thanks, Raquel. Your work has been so helpful in having your SHAC down there be like a guiding light for other SHACs, and always you and Stephanie and others have always been so welcoming and, receptive to helping other SHACs. I have a question. How often does your subcommittee meet your advocacy group?
Yeah, so during the legislative session, we met monthly. We took a break over the summer and we picked back up in the fall, but now we meet every other month.
Yeah, getting ready.
Right. So that I do anticipate, once session begins in January of next year, there will be more activity.
And you mentioned that your subcommittee advocated. Did you advocate as a group, as the SHAC, or did you advocate as individuals?
No, we did not advocate as a group. And again, that gets to those guidelines, right? So once there was some awareness of what the issues were, individuals were encouraged to express their concern if they had concern, or just get involved, really.
Yeah.
But we did not represent ourselves as members of SHAC. Again, it doesn't, you're not limited in saying who you are a part of, but just be very clear that you're representing yourself as a parent or individual.
I mean, it's great to say, I'm a member of a school health advisory council, I have children in school, or you can give all of the credentials you want as long as you don't say I am representing the School Health Advisory Council. So, okay, does anybody have questions? We have great resource here that's been through all the different stages of a SHAC. If you're interested in any other aspects of School Health Advisory Council, we're happy to answer questions. As I mentioned, we will send a recording link. We'll have contact information. Hopefully we'll have this great website up, which you can tap into and find information on the laws and different things that we've talked about today. We don't have anything on advocacy and lobbying, but I think we will add something now. It's in the formative stages. So I think it'd be great if we did add something like that. Any other questions or reactions? So we will move on to our next one. Thanks, Raquel.
Sure.
Want to hang around, and if there's any questions at the end while people are
sure,
learning about our next topic. Now that you have a little bit of advocacy knowledge on how you can participate in a SHAC and advocate for school health topics, we want to do a specific topic, how you can put advocacy to work for tobacco prevention. So I'm going to turn this over to Kristen Ortega, who is our Action for Healthy Kids El Paso Smoke-Free Coordinator, and she's going to introduce this next segment. Kristen?
Hi, good morning still, hopefully for everybody that's on, morning, afternoon time. I'm Kristen Ortega. I'm the Paso Norte Smoke-Free Project Coordinator, and today we're excited to welcome one of our partners from the Paso Norte Tobacco Control Network, American Heart Association. And so a bit about, next slide, please. A bit about the network. We are a network of organizations that work and collaborate on tobacco prevention and control activities in our region. Membership within the Paso Norte region includes community organizations and community advocates serving the El Paso County, Texas, communities of parts of southern New Mexico, and our sister city of Ciudad Juarez, Chihuahua, Mexico. And so this is just a small listing for you all to kind of get to know who we are. Next slide, please. And this is kind of what we as a network do and types of what we work together. So we really meet regularly to discuss the work or the type of services or resources that we all provide. And so we really like to leverage the organizations and maximize our resources in our communities to make sure that we are able to ensure our communities live a healthy nicotine lifestyles. And so here you'll see just provided examples of how we work together in terms of working with the Paso Norte Health Foundation and other organizations around social media campaigns, provide parent and caregiver education, educate school and school district staff about, spotting specific devices, and just working on some of that alignment with tobacco-free policies. And so that's where our wonderful segue is, and introducing our presenters for today. Mr. Alec Puente, the Director of Texas State Government Relations, and Eva Olivas, for our El Paso's Community Impact Director, for joining us, just to kind of share about youth vaping at the state and local level. And if you are from the Paso Norte region and want to stay connected, feel free to email. That's the email that you would be are able to email to. So feel free to kind of reach out and we will get you on the list. And that's basically just sharing information and continuing learning opportunities and events about what the network works on. So I'll go ahead and hand it over to Alec and Eva. Thank you so much for joining us.
Thank you, Kristen, and good morning to everyone. We're still morning on the mountain time, so we'll say good morning. Today, Alec and I are here to just talk, like Kristen mentioned, a little bit on what we're seeing or what we're doing locally, but also at the state level. So first, I'll go ahead and talk a little bit about the work that we're doing here in El Paso to kind of address tobacco usage, really in all its forms. If you can go to the next slide, please. So more specifically with youth and nicotine, we all know the vaping amongst teens and middle schoolers is a serious problem. We're seeing more than 3.5 million teens using e-cigarettes. And that's, if it's broken down into high school and middle school, because they're both reporting as using vapes. High schoolers, we're seeing 1 in 5 that are actually using electronic cigarettes, and middle schoolers are reporting 1 in 20 are actually using. And the reason why it's so important to address the issue and work with different organizations here or school districts here in the El Paso area is because of how negatively it affects youth. So some of the reasons here listed are, definitely the development of the adolescent brain and how much that harms that development, resulting in addiction, reducing impulse control, negatively affecting attention and cognition, and increasing the risk of mood disorders. So as I mentioned, it's a known issue that we're seeing. A lot of the work that we're doing is at the school district level. And that's really because schools are the front lines of this youth vaping epidemic. So we have been concentrating our work on trying to work with districts, and I'll go a little bit more into detail on that. For now, like Kristen mentioned, if you can go to the next slide, Michelle. Like Kristen mentioned, we are all a part of the Paso Norte Tobacco Control Network. And I mean, she explained it perfectly. We're all able to connect regularly and collaborate on some of the issues. We're definitely looking at tobacco usage in all its forms and how we can prevent that, how we can help communities have a healthier environment. So these are some of the things that we do as a network is, trying to create and maintain smoke-free environments where we live, work, learn, and play. So just an example, most recently, we were able to work with the city of Horizon, which was the last municipality in the county of El Paso who did not have a smoke-free ordinance. And so we were able to work with them so that they were able to adopt a pretty strong smoke-free ordinance that was gonna prevent tobacco usage in all indoor spaces the way the El Paso ordinance had it. But in this case, we also included parks and walking trails so that people wouldn't be able to smoke around children in play areas. It was an issue that we had seen in Horizon. So we went ahead and included outdoor air as well. connecting parents and caregivers, school staff, and other community members with up-to-date information and education on tobacco vaping. There's organizations within the network that go to schools and give presentations, parent presentations, to educate and bring awareness on some of these issues. A lot of times parents, even school administration or teachers, don't know how to identify what electronic cigarette looks like. So a lot of that education and awareness is being taken to parents and school staff, and organizations within the control network are all working on making sure that we're bringing awareness to that. Connecting all of these community members to quit tobacco resources. So we're definitely trying to bring light to the Texas Quit Line and different resources that we know are available within our communities, so that anyone who is smoking has the right resources and knows where to go if they're trying to quit but haven't been able to. Implementing quit tobacco resources and lung screening programs with healthcare providers and clinics. Again, an example of that is we're working with clinics on having them implement an e-referral to their EMR. And that makes it so much simpler for providers to be able to provide those resources and get their patients who are ready to quit with the right resources. And maintaining tobacco control and tobacco-free environmental policies and practices that align with best practice. So that's a little bit of what we're doing with schools. And I'll talk a little bit more about that on the next slide on how we are working with schools. But first, sorry, I lost the track of how my slides were, but why are kids using e-cigarettes? We've heard kids are falsely believing that e-cigarettes and other tobacco products are safe. A lot of times kids are hearing that it's just water vape, or it's not as bad, or it's a lot smoother than a cigarette, so they feel like it's safer for them to use. They're unaware of higher concentrations. Just an example, 1 Juul pod is the same amount of nicotine as an entire pack of traditional cigarettes. And that's something that they're unaware of. They're seeing that it's being used by a friend or a family member. And then also the industry is targeting the children, right? They're putting out appealing flavors like mint, candy, fruit, or chocolate. And kids are talking about these flavors to each other as if they're trying actual candy or actual flavors like this. So it's definitely an issue where it's being targeted to the younger population. Nearly 90% of smokers first try a tobacco product by the age of 18. However, if people don't start using tobacco by the age of 26, they're likely to never start. So we're definitely concentrating on the younger population, the children who have started using before the age of 18, on educating them on some of these misconceptions that they have, providing them with resources. So now I'll go ahead and talk about what some of that work is looking like in our districts. So something that we've been working with the school district on is really adopting a holistic approach. So what we're talking to districts about is them to provide education to their students, educating all of them on tobacco products, policy and environment, ensuring that they're enforcing a 100% tobacco-free environment, and making sure that they are providing a supportive approach for students who are caught vaping. So this is really working with districts to ensure that they're not suspending any students who are being caught with any sort of tobacco product. What we are suggesting instead is that they take a more holistic approach, that children are receiving counseling, that they're receiving the resources and the education to help them quit, as opposed to just having the child be removed from very valuable educational time. And on the next slide, we can talk a little bit about why that's important. So according to the CDC, the most effective approaches to help students quit tobacco are through counseling and education. This gets lost when students are just suspended or removed from class because they were caught either vaping or using traditional cigarettes. Incorporating cessation strategies that can guide the students towards quitting while they remain fully engaged in their education. So we're working with districts to ensure that a stepped approach is taken. So like I mentioned, instead of them being removed from their extracurricular activities as a form of punishment, or them being removed from the valuable class education that they're getting, is that instead the students are going through that stepped approach, talking to a counselor, having parent-teacher conference to make sure that their parents are aware so that they are providing a supportive environment at home to help them quit. So we're definitely looking at it as tackling the issue by providing the resources to help them quit. The use of suspension also increases the likelihood of negative educational outcomes. That means lower test scores, lower graduation rates, and reduced likelihood of enrolling in post-secondary education. So really trying to avoid having the kids be removed from class for being caught with tobacco products. And then avoiding punitive discipline would support students' academic achievement, improve their health, and decrease the inequities that we see within the districts. So when we go to districts, we do offer assistance. We actually, and Kristen and I are the ones working heavily on approaching the districts. We are working directly with the SHAC. So we do take it to parents and to staff that attends these SHAC meetings. We want to hear their thoughts. We want to see what their concerns are, what they're seeing in the school. So we're really trying to learn. Each district is different. So we go to each SHAC with just an open mind and really trying to understand what issues they're facing. If the school's already having a supportive approach, but it doesn't show that in their policies, then we're just helping them update their policies. It could be as simple as, hey, let's give credit where all the hard work that's happening and making sure that it's something that is sustainable for the district, that stays and is done for many years to come. So we are working with the SHACs, and we do provide these resources. I mean, we don't provide, in some cases we do provide, but in the next slide, there's a list of resources that are available for districts that do need, that might not have access to these resources already. Thankfully, we have some CDC funding here in El Paso through the REACH grant, where we're able to pay for some of this training if the districts need it. So we are trying to work with districts and make it as simple for them, not cost effective. I mean, without a cost at all, making it cost effective, because we do have grant money here that helps cover some of these costs. So that's just in a nutshell some of the work that we're doing with districts, and why we feel it's so important to really tackle this vaping epidemic with youth through education and resources and cessation, so that we're able to help them quit the usage of tobacco. And now I'll go ahead and turn it over to Alec, who's our State Government Relations Director, and he'll give us a little bit more on what we're seeing statewide.
Yeah, thank you, Eva. Before we move on, I just wanted to give other people a chance to ask any questions before we move on to other topics. I don't know if y'all had any questions for Eva.
So Eva, y'all have presented to quite a few SHACs in El Paso, haven't you? Did you find that they were kind of unaware, or were they fairly knowledgeable about the issues around vaping?
It depends who attends the SHAC. some SHACs have their resource officers attend, or security guards who are well aware of how many students are being caught with vapes. Other SHACs aren't aware really, or they don't have the same knowledge as some of the sort of the boots on the ground that are within the district, if that makes sense. So we've heard different opinions on what we're trying to do. But for the most part, I mean, SHACs have been very supportive. They do like the idea of being able to keep kids in the class and provide resources to them. But yeah, I think the SHACs that we've been to where the resource officers are present, that's when we really get a better picture of what the district is seeing. I don't know if Kristen, I know Kristen and I both attend together, so I don't know if she has anything else that she wanted to add on that.
No, I think you summed it up pretty quickly. It's just the variety of perspectives that different SHAC members bring, and depends on who's in the audience. And I think that, you know, it's been great to be able to use the SHAC as a mechanism to ensure that there's specific alignment with best practice and what we do as public health organizations, and how we can support the school district in that way. So it's.
Have the districts themselves been receptive to the non-punitive discipline options? Or is that something you're really having to work with the SHACs to try to convince them to do that?
There's some districts who are already working towards PBIS, which is the public behavioral intervention. With their, so they're already headed in that direction, where they're trying to have a more stepped approach for different issues that they're having with the students. But I mean, we have run across districts who are nowhere near doing a positive behavioral intervention system, and they are having a harder time wrapping their head around, like, I mean, we've heard from parents that are like, kids will never learn. You know, if you're giving them X amount of chances, every time they get caught, they're never going to learn. They're never going to learn their lessons. So it's really about just, you know, taking some of these facts to them, what we're seeing in studies, and why it's so much more beneficial to have kids stay in class as opposed to having them learn a lesson by being suspended from class.
Thank you.
And they vote, and the SHAC themselves, and just to add to what Eva mentioned, is that like they also vote as a SHAC. And so we have seen parents where there are some parents that don't necessarily kind of agree in terms of providing that perspective that Eva has mentioned. So we have seen, like, we have kind of navigated and spoken with those SHAC members who are parents or community advocates, because we also see community advocates in the smaller school districts, right? And so that's kind of where where it creates more of the majority that ends up, after we are able to provide the recommendations, it passes usually to go on to provide those recommendations to the board.
Thank you. I appreciate that. So I think it's important to get in front of those SHACs and get their support to make sure that we're moving forward in a positive manner, best practice.
And I just quickly, before Alec starts, I mean, there's advocates in anyone. I mean, we've got youth within the school districts that are like, I want to tell the board why this is important to me. So, I mean, you know, really leveraging all the support that is within the community to really try and go in this direction is also very helpful.
That's a really good point. That nobody tells it better than a student.
Yeah,
we've taken students to the state legislature, and they've made a bigger impact than anyone with the statistics and data could ever make with a legislator. So those youth are really important to making the case for vaping. Thanks.
Yeah, thank you, Eva. Thank you, Michelle. That's a great point, and I'll make sure to talk a little bit more about what you mentioned, Michelle, later in this presentation. But But yeah, I'm Alec Puente. I'm the American Heart Association's Government Relations Director. And so I wanted to give you a bit more about the statewide perspective on this issue and maybe help illustrate some of the differences between advocacy and lobbying, like we were speaking about earlier. So Eva did a really good job kind of explaining what that local on the ground work looks like as far as changing those policies, working towards more supportive approaches for students. And one sort of shortcut to thinking about where it becomes lobbying is, well, do you need a bill, or in some cases a local ordinance to change this issue? So so first I wanted to give a bit more of the kind of broader background on tobacco in Texas. Some of these stats you're probably familiar with, but I wanted to highlight a couple of them. One is that we know tobacco use is associated with lung disease, heart disease, stroke, cancer. And we have 25% of cancer deaths in Texas, at least partly attributable to smoking. If you add up all of those other issues, it comes out to almost 30,000 tobacco-related deaths in Texas. And while you don't want to put a dollar amount on a person's life, we also need to keep in mind that it's a very, very costly issue in dollar amounts for the state of Texas. So in total healthcare costs, that's almost $9 billion for the state addressing those issues. And in Medicaid costs, which we know is a public program, so those are taxpayer dollars, quote unquote, that's almost $2 billion in Medicaid costs. In terms of what that might mean for you individually, that works out to about $759 per person and what they're paying just to address those harms of tobacco. And while we know that we need to be spending more resources to address tobacco, to pursue these supportive approaches to cessation and control, unfortunately, the vast majority of those dollars are spent addressing the harms rather than preventing them from occurring in the first place. So yeah, we want to make sure that in the long term, we look at ways to shift that approach toward preventing this problem from occurring. And obviously, the environment in schools and that time in young people's lives makes a big difference toward going that direction. So we can move to the next slide. Excuse me. So Eva talked a lot about this, so I don't want to rehash what she already explained very well. But we know that the rise in vaping has basically reversed decades and decades of progress in tobacco control. And because, as Eva was explaining, these devices are very different. They're smaller, you can use them more easily, you can conceal them sometimes in a bathroom or a locker. Young people use them much more often. They're much more easy to become addicted to. And so at this point, we have nearly 1 in 4 high school age kids reporting having used e-cigarettes. Those are by far the most popular tobacco product used by adolescents. And as we discussed a little bit, and I think this is the most important stat, nearly 90% of smokers will try their first tobacco product before they're 18. It's just such a crucial time in a young person's life in terms of brain development and vulnerability to addiction, that if we can get them to adulthood without taking up this addictive behavior, it's really, really unlikely that they're going to take it up as adults. And then, of course, a lot of people falsely believe these products are safer. They don't realize how little research has been done into the chemicals that make them up. And they really don't realize how much nicotine can be delivered in just a very small jewel pod or something like that. And so we want to make sure not only that kids don't take up that addictive behavior, but that they don't take it up because of the potential to transition to cigarettes or other drugs down the line. We can go to the next slide. And so in terms of what is needed as far as lobbying for better policy, we call it the tobacco endgame. We want to see those tobacco rates ultimately go towards zero. And so we need strong government oversight, better regulation of all sales and marketing of tobacco products. And that starts, from the beginning, preventing things like celebrity endorsements, attractive advertising placements, locations near schools, banning the very, very attractive fruity candy-like flavors that really seem designed to appeal to kids. And just like you see on cigarettes, putting large, obvious warning labels, explaining to people how much nicotine is in these products, what the downstream effects could be. And for those products where the manufacturers say that they're designed to prevent people from smoking, to help them transition off smoking, require that they prove that it does what they say and isn't just a smoke screen to get addictive products to young people. Thank you. I forgot to tell you to move on. So in terms of just kind of setting the baseline for where we are in Texas, I think it's useful to think about this in terms of, what are we allowed to do on the ground versus what has the state prevented us from doing? So one thing the state has not prevented communities from doing is undertaking better smoke-free ordinances. So at this point, more than 100 cities, I actually think it's closer to 200, have passed either comprehensive or close to comprehensive smoke-free ordinances that prevent smoking and a lot of times vaping in the workplace. But on the other side of that equation, the state does not allow local communities to regulate the retail side of tobacco. So the city cannot tell a tobacco retailer not to locate next to a school or, conduct their own enforcement checks, that sort of way. Actually, I think they can conduct enforcement checks, but they can't set the rules for what they're enforcing, if that makes sense. The state taxes regular tobacco products, cigarettes, cigars, but does not tax e-cigarettes on their own. They pay sales tax, but nothing for being a harmful tobacco product the way cigarettes do. And we also know that overall tobacco control funding, that's for things like education, cessation, enforcement, are far, far, far below what is recommended by the Centers for Disease Control. I think it's in the single-digit percentage of what's recommended. But there have been some recent improvements to this landscape. Just last session, we helped pass, along with some of the partners on this call, within the Texas Tobacco Control Coalition, to pass a bill that required e-cigarette retailers to get a very, very similar permit to what we require for regular cigarette retailers. Before that, they didn't have to secure any permit from the state. So that kind of moves e-cigarettes more in alignment with how we approach tobacco normally. And then, as many of you know, in 2019, the state got out ahead of the federal government to raise tobacco sale age to 21. And that was a big change, going back to what we said earlier about how important it is to get young people to adulthood without having taken up this habit. We can move to the next slide. So looking ahead to next session, there are a few different priorities we can kind of see on the horizon. One of those is really just protecting what we have now as far as tobacco enforcement resources, but also looking for ways to expand that and making it more likely that retailers will get an enforcement check or that people can access the resources they need for cessation. We also want to see the tax on e-cigarettes match that for cigarettes, and ideally have them both increased, because they haven't in a very long time, and they certainly don't match the rate of inflation or where they should be to be effective. We also want to see the enforcement systems improved. Even though we passed that bill to require permits for retailers, we still want to make sure that they get an enforcement check at all. At this point, it's pretty unlikely that any individual retailer will get an enforcement check, even though the state does their best. And we just want to make sure that retailers are held accountable for not selling those products to minors. Of particular interest to this group is interest in looking at laws that require penalties for possession, use, and purchase of tobacco. That is not the most supportive approach, and we know it doesn't really do much to get you towards cessation. And so we'd like the emphasis to shift more towards preventing the use of tobacco and supporting people who'd like to get off, rather than punishing them for an addictive habit, especially a young person who has less control over what they're doing in that respect. And then finally, continuing to educate and address around flavored tobacco products. That's really the driver of what makes some of these products so attractive and so addictive. And to the extent that we can control what sort of flavors are put in front of people, it can go a long way toward making these products less attractive. We can go to the next slide. So just to share some of the high-level points that I think are really effective when you're communicating with policymakers, with lawmakers about this issue, is the one we keep hitting on, is that this is a really, really crucial time in a young person's life, and that we need to protect them from what is a very, very addictive substance, especially one that's delivered in much higher concentrations than what we're used to in past decades. We need to pursue supportive approaches to quitting. We know discipline does not encourage people to quit, and also has a lot of other effects. It makes them less likely to graduate, less likely to go on to secondary education, more likely to miss more school. And that doesn't help anyone. And so it's time to kind of rethink how we're approaching those students we identify as having that issue. And then going back to what I was saying about making it more likely that retailers see enforcement, we want to shift that burden of enforcement towards the retailers and not on young people. We've seen data from other states that basically much more money is spent enforcing those laws against young people, against lower income communities than is spent enforcing on the retailer side. And we would think that's really a missed opportunity. And then finally, it's really important that we tax these products at least the same way that we tax regular tobacco products, if not increasing both. Young people are our most price sensitive consumers. And if we can make those products more difficult to acquire, it's a lot less likely they'll get them. We can go to the next slide. So I wanted to share a few opportunities for involvement in this issue. Those are links. I'm not sure if you can click on those, but if not, when you get the slides, you're welcome to click through for more. The first is our Tobacco Endgame program. I wanted to mention this first because it's specifically for young people. Like Eva and Michelle were mentioning, those are oftentimes really our best advocates. I'm thinking of a bill last session that was really a tobacco industry friendly taxation bill. And we had one of our youth advocates in high school, I believe she was maybe a junior or sophomore or junior, show up in front of the committee, explain why this was not a helpful bill for the problem she saw in front of her every day. And the committee, really listened to her. They took into account her concerns. And a few months later on the floor, when it came up for a vote, the author explained the changes in part as having come from her hearing from a young person in the committee. And so if you do know any of those motivated, interested young people, we really encourage you to help refer them to that program. We'll help either plug them into ongoing campaigns in their area or that they might be interested in, or maybe help them identify opportunities to start up a new one. Excuse me. The second I wanted to mention is our Tobacco-Free Schools initiative. Eva mentioned a lot more about that. That's just kind of a toolkit, a package of resources we have to help school districts that are interested in undertaking this approach. What it would mean for your quote unquote disciplinary policies, how you can do it in the best possible way. And then the last one was just our kind of general purpose, You're the Cure network. And there's no need to click through on that one, Michelle, but that's our network of advocates interested in all sorts of issues. But for our purposes, we're talking about tobacco control and cessation. That will plug you into both our local campaigns and our statewide campaigns. But we're very, very respectful of your inbox. We're careful not to bother you about campaigns way outside of your area or that you haven't indicated interest in. But if you're interested in hearing more about what might be going on where you are, we really encourage you to sign up for those updates. And then finally, I have our contact info here. If you have any questions for me or for Eva, those are our email addresses, and we'd welcome a chance to talk to you more about any of the things you heard about today.
Thanks, Alex. Does anybody have questions? The one thing that I discovered, because this is all new to me because my kids are grown now, but the high levels of concentration of nicotine in the vaping products just floors me. And I think there's so many people, particularly legislators and people that are in, the power places, that don't know what they're getting into and how serious those vaping products are. They think that they're, less nicotine, not more. Yeah,
it's hard to believe how much you can pack into, I guess it's probably not even 1/8 of an ounce in those little packets, but especially now that the industry is moving towards, quote, synthetic nicotine, where they can derive nicotine without a tobacco plant, they can really up the concentrations in there. And not only that, but they can argue a lot of times that it's not even a tobacco product and shouldn't be taxed like one. And so the tobacco industry definitely has the resources and expertise to develop these novel products and really get ahead of policy in a lot of ways. So we need to be kind of constantly on guard for the way they can create new ways around these interventions.
Well, and I've been privileged to see the information that Kristen and Eva are sharing with SHACs and parents in El Paso. And it's just interesting the different vaping products there are out there, and they're all available on the internet, and they look like, you know, anything except something that you would be smoking with. So
right, I live in Austin, kind of near UT Austin, and that's not the youngest people we're talking about, but they're still very young people. And the corner stores around here, and just the entire back of it, apple, lemonade, grape, raspberry flavored vaporizers. So they know how to reach their target market for sure.
Yeah. But those aren't appealing to children. Those are for adults, right?
Exactly. For the professors.
Yeah. Well, does anybody else have questions about school health advisory councils or about any of their information on vaping and tobacco prevention? I think, it's really critical that our school health advisory councils get engaged in this. It's been a few years since I was on our local SHAC, but I remember parents of high school students coming to us and saying, our kids are doing this at school and nobody's paying attention because nobody really thinks it's serious. And this shows you why it's so important to communicate with legislators and school board members and school administrators. And that's why all of you are critical to our children's health. Just writing a letter to a school board member and saying, have you looked into the issues around vaping and tobacco prevention, and sharing a little bit of the information you got today, or writing a letter to your state legislator and saying, this is important. Next session, when the Heart Association comes to you to ask about new policies around tobacco, please pay attention because our kids are suffering from this and it's more serious than you might think. A lot of times I feel like our legislators, they want to do what's right, they want to do what's best, but they just don't know. There are so many things that they deal with. So that's why it's so important to advocate around issues like vaping and tobacco prevention.
Yeah, and I should add, if anyone needs any help figuring out as far as timing or targets, who to talk to, maybe the best way, talking points, I'd be happy to talk to you about, who you can get in touch with, whether in a lobbying or non-lobbying fashion, but definitely here to help anyone who'd like to be more involved.
Awesome. Kristen, did you have some parting remarks for us?
No, I just wanted to say thank you so much for Eva and Alec, and we really do appreciate the partnership. And Eva and I really do use that toolkit that helps explain those criteria and the different aspects. There's materials for each audience of the parent caregivers when you're engaging school board members, when you're engaging all these different audiences. And so I think that just wanted to part with that to let you all know that those resources are, being used, and those are the ones that we use. And that's, I know the slides are going to be shared after today's workshop. So if you want to look and check those out, those are the ones that we also use for our local efforts here with tobacco-free schools.
I think something else.
Can I mention one more thing?
Yeah.
Just this hasn't come up yet, but it does come up a lot. So I wanted to mention it as far as undertaking more supportive approaches to tobacco at the ISD level. A lot of questions come up as well. Don't we have to punish the students? And the kind of answer to that is the state doesn't require that you punish the student. It requires that the school district prohibit tobacco. As far as how they address it and what their approach is, there's a lot more flexibility than I think a lot of policymakers understand. So I just wanted to highlight that.
One of the other things I think that is happening in El Paso is working with the communities and schools. They've been very receptive to helping present information through them to parents and to different individual schools, because it's really challenging to get information out there to everyone. So partnering with other organizations in your community that can help you at that school level, because each school really has to have some type of intervention. It can't just all be at the district level. We've got to get it back down to the campuses. So finding ways to make sure that the information is getting down where it needs to be is really critical.
I was just going to add, Michelle, that early on, one of the misconceptions we heard from the districts was they couldn't do anything because it was all determined at a state level.
Yeah.
And they couldn't change anything coming down from the state, but the policies that we're working on are all local. And that gives the board the ability to hear the recommendations and make some of those changes, whether it's to the student code of conduct or to some of those local policies. And I did just want to add that the work that Kristen and I are doing here in El Paso, there's someone within AHA that's doing that work in the whole state of Texas. So there's community impact directors in Austin working with school districts in that whole county. There's some in Houston and North Texas. So if there's any districts on here that are in any other part of Texas, we've got some resources out there as well.
Awesome. There's a couple of notes in the chat. Kristen has mentioned that in their education presentations they always say join the School Health Advisory Council and share your voice. And then Melanie mentioned they've been successful at the campus level with campus wellness committees, which are really, essential if you want to make change happen at the campus level. And they can also feed into your district SHAC and your district policies as well. So are there any other comments or questions around tobacco or school health advisory councils or advocacy at this point? We did finish a little early, so we will be reconvening at, let's see, 2 o'clock Central, 1 o'clock Mountain. So you have about an hour and a half before we come back. We will have 2 more presentations, one on PTA and volunteers and advocacy and safe routes to school. So I think those will be great. I will sign back on a little early. If you think of some questions that you didn't get to this morning while we were talking, then you can log back on a few minutes early and I'll be happy to chat with you. So thank you, Alex. Thank you, Eva. Thank you, Kristen. And a special thank you to Raquel for everything that you have shared. You can either, by the way, you can either sign off and then sign back on and we'll readmit you, or you can leave it open, whichever works best for you. But you'll use the same link that you used to join us this morning. So I appreciate y'all, and we will see you back here in an hour and a half. Thanks.